After it dropped considerably after the Affordable Care Act's passage, the uninsured rate in the United States it's flattened out. It's really not. We're not really seeing any gains, and in fact, we've seen a little bit of an uptick in the rate. About 27 to 30 million people are currently uninsured, including about 2 to 4 million people in states that haven't yet expanded eligibility for Medicaid. At the same time, the number of working age adults who are insured all year but have but are underinsured has risen to about 44 million people. So these are people with high out-of-pocket costs and deductibles relative to their income. In employer plans, where about 150 million people get their insurance coverage, affordability overall is declining. The workers' premium contributions for these health plans and their deductibles, again, relative to their income, is climbing pretty significantly. In the individual market, after a few years of volatility, the ACA marketplaces are pretty stable. The premium subsidies have really helped people afford coverage in the individual market. But people with incomes that are just over that threshold that makes them eligible for subsidies are really finding those premiums to be pretty unaffordable. And deductibles can also be quite high in the individual market for people who aren't eligible for cost-sharing subsidies. And I think it's likely that these costs, the premium costs, the out-of-pocket costs that people are now exposed to, particularly through deductibles, are really fueling this concern and angst we're seeing among voters about their health care costs and their fear of not being able to afford their care in the future.